With parathyroid disease, the important thing to remember is that it is a biochemical diagnosis. We make the diagnosis based on your labs. So if we're confident that you have the condition based on your labs, then the imaging test really is to help us to decide what's the best surgical approach and how should we approach surgery. Imaging tests don't make the diagnosis. So once we know we have the condition, if we get imaging tests, it helps us to identify who might have a single adenoma and who might be a candidate for a more focused approach. But if the imaging tests are negative, it doesn't change the fact that you have the condition. You still have the condition and you're still absolutely going to benefit from surgery. It's just that the imaging tests aren't going to tell us exactly where it's going to be located or where we should start. I think the key is with parathyroid surgery is I always think about kind of three questions. Really is, do you have the diagnosis? And really that's based on labs. And then if you have the diagnosis, are you going to benefit from surgery? And what are the potential benefits? And then once we know that you're going to benefit from surgery, then what is the right surgical approach? And that's where imaging should come into play. I think too often I see patients get imaging studies that are negative and then are told they don't have the condition. And I think that that's wrong. The diagnosis is based on the labs, not on the imaging.